for signs your sexual health needs attention for lifelong wellness. Your sexual health is a vital part of your overall well-being, and in your teens and 20s, the habits you build can shape your future, from preventing sexually transmitted infections, STIs, to protecting fertility. Safe sexual practices are not just about avoiding immediate risks, they are about ensuring lifelong wellness. Yet, many young people overlook subtle signs that their sexual health needs attention, risking complications that could affect them for decades. Some navigate these years with confidence, practicing safe sex and staying informed, while others ignore symptoms or skip precautions, unaware of the consequences. What makes the difference? It often comes down to 4 key signs, clear, research-backed indicators that your sexual health needs care. In this guide, we are diving into these 4 signs, grounded in research from the Centers for Disease Control and Prevention, CDC, and sexual health studies. These are not fleeting oversights or minor issues. They are critical signals that can guide you to protect your body and future. By the end, you will know exactly what to watch for in your habits and health, and more importantly, how to take action to ensure lifelong sexual wellness. Stay with us until the end, because you might be missing small choices that could have a massive impact on your life. Let us get started and uncover the secrets to maintaining a healthy sexual life in your teens and 20s. Sign 1. Unprotected sex. One of the most significant signs that your sexual health needs attention is engaging in unprotected sex, particularly not using condoms or other barriers during sexual activity. A 2022 study in sexually transmitted diseases highlights that unprotected sex dramatically increases the risk of STIs, including HIV, human papillomavirus, HPV, chlamydia, and gonorrhea, which can lead to serious long-term health issues like infertility or cancer. Condoms are a simple, effective way to protect yourself and your partner. Picture 2 friends, Ryan and Lucas, both 20 years old. Lucas always uses condoms during sexual encounters, ensuring he and his partners are protected from STIs. He feels confident and responsible, knowing he is safeguarding his health. Ryan, however, often skips condoms, thinking the risk is low or that it feels better without them. He is unaware that he is exposing himself to HIV or HPV, which could have lifelong consequences. Lucas's consistent protection signals a healthy approach to sexual health, while Ryan's unprotected sex puts him at serious risk. Unprotected sex is not just a momentary lapse, it is a gamble with your future health, increasing STI transmission and unplanned pregnancy risks. The good news? You can take control. Always carry condoms and use them correctly every time you have sex, whether vaginal, anal, or oral. Discuss protection with your partner openly to ensure mutual safety. If you have had unprotected sex recently, get tested for STIs at a clinic and consider emergency contraception if needed. Prioritizing protection today keeps your sexual health strong tomorrow. If you are finding this valuable, please comment number 1 below to let me know you are here. And if you have not subscribed yet, hit that subscribe button and turn on the bell so you do not miss any updates. Let us keep going. Sign 2. Ignoring STI symptoms. Ignoring symptoms like pain, discharge, sores, or unusual discomfort during or after sex is a major sign that your sexual health needs attention. The CDC's 2021 guidelines emphasize that dismissing STI symptoms can delay treatment for infections like chlamydia or gonorrhea, which are treatable with antibiotics but can cause infertility or chronic pain if ignored. Early action is critical to prevent long-term damage. Consider 2 classmates, Emma and Sarah, both 22. Sarah notices a slight burning sensation when urinating and visits a clinic immediately, where she is diagnosed with a treatable STI and starts medication. She feels relieved knowing she caught it early. Emma, however, experiences unusual discharge and pelvic pain, but brushes it off as a minor issue, hoping it will go away. She does not realize that untreated chlamydia could harm her fertility. Sarah's proactive response signals a healthy approach to sexual health, while Emma's denial risks serious complications. Ignoring STI symptoms is not just uncomfortable, it can lead to irreversible health issues, including pelvic inflammatory disease or increased HIV risk. The good news is that you can act quickly. If you notice symptoms like pain, itching, sores, or abnormal discharge, visit a healthcare provider or free clinic for testing and treatment. Be honest about your symptoms and sexual history to get accurate care. Regular testing, even without symptoms, is key for sexually active people. Addressing symptoms today protects your sexual health tomorrow. Sign 3. Low health education. A lack of understanding about sexual health risks and prevention is a critical sign that your sexual health needs attention. A 2020 study in the Journal of Infectious Diseases found that young people with low health education are more likely to make uninformed choices, such as skipping the HPV vaccine or not using protection, increasing their risk of STIs and related cancers. Knowledge empowers you to make safe decisions. Imagine two cousins, Noah and Ethan, both 18. Ethan has learned about sexual health through school programs and online resources, understanding the benefits of the HPV vaccine and regular STI testing. He feels equipped to protect himself. Noah, however, has limited knowledge, unaware that the HPV vaccine prevents cervical and throat cancers, or that STIs can be asymptomatic. He makes choices without understanding the risks. Ethan's informed approach signals a healthy sexual life, while Noah's low health education leaves him vulnerable. Low health education is not just a gap in knowledge. It can lead to preventable health issues that affect you for life. The good news? You can educate yourself starting now. Seek reliable sources like the CDC, Planned Parenthood, or your doctor to learn about STIs, contraception, and vaccines. Get the HPV vaccine if you are eligible, ideally before age 26, and ask questions during medical visits. If you feel unsure about sexual health basics, take time to read up or join a workshop. Knowledge today strengthens your sexual health tomorrow. Comment number 3 below to show you are following along, and let us keep going. Sign 4. Avoiding check UPS. Skipping regular sexual health screenings or checkups is a clear sign that your sexual health needs attention. A 2023 study in the American Journal of Public Health notes that routine screenings catch STIs early, even when you have no symptoms, preventing complications like infertility or chronic infections. Avoiding checkups risks missing silent infections that can harm your long-term health. Picture two neighbors, Mia and Chloe, both 24. Chloe visits a clinic annually for STI testing and a sexual health checkup, even when she feels fine. She feels confident knowing her health is monitored. Mia, however, avoids clinics, feeling embarrassed or assuming she does not need testing because she has no symptoms. She is unaware that untreated STIs could be silently damaging her reproductive system. Chloe's regular checkups signal a healthy approach to sexual health, while Mia's avoidance puts her at risk. Avoiding checkups is not just about discomfort. It can allow treatable conditions to progress undetected, affecting your fertility and overall wellness. The good news is that you can make screenings a routine. Schedule a sexual health checkup at a local clinic, doctor's office, or free testing site, aiming for at least once a year if sexually active. Be open about your sexual activity to ensure proper tests, like HIV or chlamydia screenings. If you have not had a checkup in over a year, book one now. Your future self will thank you. Regular screenings today protect your sexual health tomorrow. Final thoughts. Your sexual health is a cornerstone of your overall wellness, and these 4 signs, unprotected sex, ignoring STI symptoms, low health education, and avoiding checkups, are your body's way of signaling when it needs care. Take a moment to reflect. Are you practicing safe sex, staying informed, and getting regular screenings? Or have you noticed these warning signs in your habits? The good news is that every one of these signs can be addressed, and your sexual health is not set in stone. The choices you make today can shape how healthy and confident you stay for life. Do not wait for symptoms or a health scare to act. Start now. Use condoms consistently. Seek testing if you notice symptoms. Educate yourself about risks, and schedule regular checkups. Talk openly with partners and healthcare providers to prioritize safety. These small steps can lead to big rewards, because how you care for your sexual health today determines how vibrant and worry-free your future will be. Keep your body safe, stay proactive, and take charge of your wellness. Comment number 27 below if you are here.